Subscribe for daily quizzes and let me know how many you got correct today. Here's some behavioral health trivia. What is a common term for anxiety disorders involving excessive worry? A. OCD, or B. Panic disorder, or C. Social anxiety, or D. Generalized anxiety disorder? The correct answer is D. Generalized anxiety disorder. What classification of medications is often used to treat depression? A. Stimulants, or B. Antidepressants, or C. Antibiotics, or D. Antihistamines? The correct answer is B. Antidepressants. Which disorder is characterized by a persistent feeling of sadness? Bipolar disorder, or B. Seasonal affective disorder, or C. Major depressive disorder, or D. Anxiety disorder? The correct answer is C. Major depressive disorder. What therapy involves exposure to feared situations? A. Cognitive restructuring, or B. Dream analysis, or C. Exposure therapy, or D. Behavior modification? The correct answer is C. Exposure therapy. Who is known for developing person-centered therapy? A. Carl Rogers, or B. Sigmund Freud, or C. Albert Bandura, or D. B.F. Skinner? The correct answer is A. Carl Rogers. What condition involves uncontrollable episodes of sleep? A. Narcolepsy, or B. Restless leg syndrome, or C. Insomnia, or D. Sleep apnea? The correct answer is A. Narcolepsy. Which model explains behavior using biological, psychological, and social factors? A. Holistic health model, or B. Biopsychosocial model, or C. Behavioral model, or D. Cognitive theory? The correct answer is B. Biopsychosocial model. What disorder involves alternating between mania and depression? A. Borderline personality, or B. Bipolar disorder, or C. Schizophrenia, or D. Major depression? The correct answer is B. Bipolar disorder. What eating disorder involves binge eating followed by purging? A. Bulimia nervosa, or B. Anorexia nervosa, or C. Night eating syndrome, or D. Compulsive overeating? The correct answer is A. Bulimia nervosa. What type of therapy emphasizes unconditional positive regard? A. Psychoanalytic therapy, or B. Behavioral therapy, or C. Person-centered therapy, or D. Cognitive behavioral therapy? The correct answer is C. Person-centered therapy. What cognitive distortion involves seeing only extremes? A. Polarized perception, or B. Dichotomous logic, or C. Black and white thinking, or D. Absolute reasoning? The correct answer is C. Black and white thinking. What is the term for a pervasive pattern of unstable interpersonal relationships? A. Dependent personality disorder, or B. Borderline personality disorder, or C. Narcissistic personality disorder, or D. Bipolar disorder? The correct answer is B. Borderline personality disorder. Which testing is used to measure personality and emotional functioning? A. Blood test, or B. Psychological assessment, or C. MRI scan, or D. IQ test? The correct answer is B. Psychological assessment. What mental health condition is characterized by paranoia and hallucinations? A. Generalized anxiety, or B. Schizophrenia, or C. Bipolar disorder, or D. Major depression? The correct answer is B. Schizophrenia. Which neurotransmitter is commonly linked to mood regulation? A. Acetylcholine, or B. Cortisol, or C. Serotonin, or D. Dopamine? The correct answer is C. Serotonin. Which DSM category includes mood disorders? Anxiety disorders, or B, psychotic disorders, or C, personality disorders, or D, mood disorders? The correct answer is D, mood disorders. What is the term for experiencing significant anxiety about separation from attachment figures? A, attachment disorder, or B, stranger anxiety, or C, separation anxiety, or D, loss anxiety? The correct answer is C, separation anxiety. What involuntary psychological response might lead to sudden trauma-related memory, flashback, or B, repressed memory, or C, emotional trigger, or D, memory retrieval? The correct answer is A, flashback. What type of therapy promotes self-exploration through dialogue? A, physical therapy, or B, talk therapy, or C, cognitive therapy, or D, art therapy? The correct answer is B, talk therapy. What form of therapy examines interpersonal dynamics in relationships? A, behavioral therapy, or B, solution-focused therapy, or C, psychodynamic therapy, or D, art therapy? The correct answer is C, psychodynamic therapy. What is the main focus during pharmacotherapy? A, disease prevention, or B, medication management, or C, clinical trials, or D, patient education? The correct answer is B, medication management. Which condition sometimes follows an individual after traumatic events? A, anxiety disorders, or B, major depression, or C, post-traumatic stress disorder, or D, bipolar disorder? The correct answer is C, post-traumatic stress disorder. What is a behavioral intervention meant to rebuild healthy routines? A, structured routine, or B, behavior modification, or C, free association, or D, guided imagery? The correct answer is A, structured routine. What therapy includes strategies for enhancing self-awareness? A, play therapy, or B, cognitive therapy, or C, insight therapy, or D, group therapy? The correct answer is C, insight therapy. Which type of mental health provider conducts psychoeducational assessments? A, life coach, or B, psychiatric nurse, or C, social worker, or D, clinical psychologist? The correct answer is D, clinical psychologist. What term is used for irrational thoughts surrounding a person's failure? A, mind reading, or B, negative self-talk, or C, self-critique, or D, defensive pessimism? The correct answer is B, negative self-talk. What psychological condition closely relates to obsessive thoughts and compulsive actions? A, major depressive disorder, or B, social anxiety disorder, or C, generalized anxiety disorder, or D, obsessive compulsive disorder? The correct answer is D, obsessive compulsive disorder. What mental health condition does often lead to pervasive sadness and lack of motivation? A, OCD, or B, anxiety disorder, or C, bipolar disorder, or D, depression? The correct answer is D, depression. What can cause a person to change their coping mechanisms negatively over time? A, coping skills, or B, healthy lifestyle, or C, stressors, or D, positive feedback? The correct answer is C, stressors. What is termed for recognition and understanding of one's emotions? A, emotional awareness, or B, emotional intelligence, or C, self-regulation, or D, mood recognition? The correct answer is B, emotional intelligence. Which type of therapy focuses on behavior modification through rewards? A. Operant conditioning, or B. Cognitive therapy, or C. Psychoanalysis, or D. Client centered therapy? The correct answer is A. Operant conditioning. What defines a therapeutic outcome in mental health treatment? A. Shorter therapy duration, or B. Improved mental well being, or C. Symptom persistence, or D. Higher medication dosage? The correct answer is B. Improved mental well being. What is the goal of interpersonal therapy? A. Enhance physical health, or B. Cure mental illness, or C. Increase productivity, or D. Improve relationship skills? The correct answer is D. Improve relationship skills. What is a common side effect of stimulant medications? A. Nausea, or B. Muscle relaxation, or C. Weight gain, or D. Insomnia? The correct answer is D. Insomnia. What is essential for effective communication in therapy? A. Medication management, or B. Empathy training, or C. Psychotherapy techniques, or D. Active listening? The correct answer is D. Active listening. Thanks for watching. Comment with how many questions you got correct. Should we make the next video have easier or harder problems? Was the difficulty just right? Do you have suggestions for future trivia topics? Don't forget to drop a like and sub if you enjoyed the video.